I think one of the biggest issues with health literacy is simply understanding that most of our patients, I would argue, at least in my practice, over 50% of my patients would have issues reading the materials that we send them home with. And unfortunately, I don't know that that assessment is done. So much of the focus is put on fixing the problem, particularly the cardiovascular problem, that we forget to look at the fact that these patients are scared. Their ability to comprehend what's going on is going to be diminished anyway because they've had a life-changing event. So one of the simplest things we could do as pharmacists is just a simple assessment of health literacy. The one that I actually prefer the best is a single item literacy screener, or SILS. It's a single question. It's been validated versus several other health literacy evaluation tools, but you can ask it once. So even if somebody's trying to get out of the room or leave the counter, you could ask them, and you simply ask, how often has somebody had to help you read and understand materials that are given to you by your doctor or pharmacist? If they respond never or seldom, they would get a score of less than 2. In that case, then you're not really concerned about their health literacy, and you can kind of treat them like a normal patient in terms of how you counsel and so forth. If they respond always or often or more to that effect, then there's a concern with them having issues, at least in their ability to comprehend the materials you're sending home with. And then they need to be the counseling needs to be a little bit more focused. So simple things like moving away from any medical terminology whatsoever. I mean, even the explanation, using words like ACE inhibitor, people have trouble with that. So multi-syllable words should be diminished. Taking your time, utilizing pictures, always doing the teach-back method, focusing on need-to-know things only. On average, literature says 3 to 5 things. I tend to not go over 3. If I need to tell them more, I'll try to arrange some level of follow-up so I can talk to them again. But I find that to be the best is identification, and then also engaging other family members, because potentially the other family member can help to explain and work with them.